We've heard that people put out all the time that if we do have national health insurance that comes in place into the Bahamas, that will decimate our private health insurance industry. What this goes to show is that even amongst countries that currently have a universal health coverage system in place, the simple fact is that many of them already have a high penetrance of private health insurance as well. Even a country such as Canada, that has one of the best universal health coverage systems around the world, even they have 2/3 of their population that have private health insurance as well as a supplement to what they provide. So even having great healthcare systems and healthcare insurance systems don't decimate what it is that you can have in your private health insurance industry. So we know that that will continue to survive as well. So this leads us to showing that we not just need it financially, we need it health-wise in the country as well, and that we'll continue to have industry even when we have it in place. So what is NHI Bahamas? NHI Bahamas is a mechanism that we look to put in place so that we can ensure that all legal residents of the Bahamas, no matter your age, your income, what your health status is, where you live in the Bahamas, everyone will have the ability to receive an equitable access to care, to good quality, comprehensive care without having it risk their financial status. So as we introduce even the first levels of care, you'll notice that that care is delivered free of cost to people as we have it done. The reason we want to do this, as we emphasized before, is that there are more than 200,000 Bahamians at present that have no form of health insurance. So knowing that only 1/3 of Bahamians have health insurance, we know that people aren't accessing care the way they need to be. In fact, a survey that was done recently in the Bahamas actually said amongst those people without health insurance, 1/3 of them are saying that they did not access some form of health care because they could not afford that care. That is startling to let us know that there are people out there, because of the high cost of healthcare in country and not having the protection of health insurance, they presently are not accessing even basic care that they need. We know that in addition, even without having access to that care, that people are still already spending somewhere around $2,300 per household out of pocket on healthcare services. This doesn't even begin to account for what they spend in private health insurance, but as a household, they're already spending this. This can lead to, and as you know, our average income in the Bahamas is about $22,000 per year, so people are spending 10% of their income out of pocket already on healthcare services. And if you added in the amount that people are already spending on private health insurance, you can see that health expenditures, even at the household level, are almost at a catastrophic level for them. We need to do something that will address that here in country. So we must improve access and affordability and the quality of our health care for all of our people. Again, our infant mortality is high. Our rate of diabetes is noted to be, if not the worst in the Caribbean, the worst in the world. In addition, we have high rates of heart disease and cancer. And as noted before, we have low utilization because of our lack of the ability to access our healthcare services. So we need to really address some of the values that we want to put in place for national health insurance. These include equity, comprehensiveness, plurality, making sure people have access to private and public health services, all wrapped up in a manner that allows us to deliver a more modern, a more affordable, and a more accessible healthcare system to the citizens and residents of our country. NHI Bahamas is about choice. We want to provide you with the choice of being able to choose your provider. In the first instance, you'll be able to choose your primary health care provider, no matter whether it's in the public sector or the private sector. If they sign up as providers to be a part of National Health Insurance Bahamas, you will have access to being able to choose them, regardless of whether they're in one sector or another. We want to bring them together to be a part of this for the benefit for all Bahamians. In addition, as we have our negotiations with our colleagues within the health insurance industry, we too want to make sure that they're a part of this as well, and that gives you the choice of being able to choose who your regulated health administrator or insurance provider is. National Health Insurance takes care of making sure that the payments are made to them so that they can make sure that your benefits are delivered. They become your administrator of your benefits, much like they are now. So we want to make sure that you have the choice to do so, and you're not forced one way or the other, and you have both provider choice, public or private sector, but also public or private sector choice in your insurance provider as well. We talk about wanting to stage this or phase this in, and the first phase of this has already started. We know that when we started to revamp the registration around national insurance and making sure that you get your new NIB smart card, that launches a step that allows us to get a database of people here in the Bahamas who are going to be eligible for national health insurance. Those people will then, once we have them in the database, be able to present themselves to National Health Insurance for their enrollment. They'll be able to take that step where they're able to choose their primary care provider or choose their insurer. Once we have people having had made those choices, then we're able to move on to step 3 or phase 3. As you know, we need to have people enrolled. We need to have them registered to be able to get there, because if we don't know who those people are, we can't start delivering service. But at phase 3, that's when we get to actually deliver the service that people are looking for. You'll be able to use that new National Insurance Board smart card after having made those choices to actually start going to that primary care provider that you've chosen to get the kind of services that you need on an everyday basis, or at least on a yearly basis. We'll go a little bit more into what those services are, but just to move on, explain the other phases. Phase 4 includes select catastrophic coverage. We know there are particular issues that cause us health-related issues here in country, and those things are things that we're going to have to address first, even before we're able to roll out a full, comprehensive package of services. So things that affect us, we talked about those high infant mortality rates. We talked about the high issues and incidences of heart disease and diabetes. These are issues that have select complications that we are going to need to be able to address as we move forward. Those are the things that our catastrophic coverage will be able to address even before we have that full benefit package. Because we need to address things early. We need to be able to address those things that are affecting our people right now, and that's what's going to be put in place in that phase 4. When you think about phase 5, think about the type of insurance benefit package that you would get as a comprehensive package from a health insurance agent. This is what is going to be rolled out, but for all Bahamians, regardless of your income, regardless of your age, regardless of whether you have a pre-existing medical condition or not. Once it is rolled out, you have access to all of those services once NHI gets to phase 5. So what we do note here is that we'll also have some health system strengthening activities going on. We'll go into that a little bit later, but note that in order to make all of these things work, we need to make sure that our health system is ready for it, that it's prepared for it, and we strengthen it to the point where people will have faith and can believe that we'll be able to deliver on the promises that we're talking about right now. We do know that there's a question about who is going to be covered. Again, this program is for all legal residents of the Bahamas. We want to make sure that there's no discrimination as we go through based on your income, based on where you live. Everyone will have access to it. Doesn't matter if you're old or if you're young, whether you're employed or unemployed, everyone will have access to National Health Insurance Bahamas as long as you can show us that you are eligible to receive those benefits. What is going to be covered? We'll cover mostly when we talk about primary health care services. What we're looking at through National Health Insurance is making sure that people are able to see a doctor. They're able to see their healthcare professional. That is covered on those essential services on an outpatient care basis that people will need on a daily basis. Are you able to get your annual physical? If you have a minor illness that needs to be seen in an outpatient setting, do you have access to those services? Those are the types of things we need to make sure people have access to, because the issue is people not being able to access it now means that whatever illness they may have or health condition they may have may not be detected until it's too late, or it gets too expensive for anyone to be able to address it. So there's a reason why this needs to be addressed early, and we start with primary care services. In addition, your referral for other diagnostic services, your referral for a mammogram, your referral to make sure that you can have your PSA done, your referral to get some of these other services such as laboratory services or prescription medications and a prescription for it, all of those things will be covered, and your medications and diagnostic services on an outpatient basis, if you need to have lab studies done, if you need to get those medications that can be delivered on an outpatient basis, those are the things that will be covered through National Health Insurance during the primary care phase. But a good thing to remember through all of this is the fact that all of those things are being covered for you with no new payments that are necessary. There will be no new taxes. There are no contributions that are going to be required. There's no copay when you go to access the service, and there's no deductibles for it. What this really means is that we want you to be able to see, touch, and feel what National Health Insurance does for you, especially at the primary care level, without having anything having to come out of your pocket, whether through payroll, whether through service fees when you present yourself. We want to be able to deliver those services to you without having the fear of what it is going to cost you to have those services delivered. So that's how NHI Bahamas is a benefit to you right now. People talk about we already have some form of universal health coverage. That is true. We have made steps to get toward universal health coverage. But the simple fact of the matter is that people still are not accessing care because of those costs. Even the registration fee in the public health sector, many of us as Bahamians don't have the ability to be able to pay that fee, so we don't access those services. Other times, even if you can see the doctor for free, when you need your medications, when you need an ultrasound, when you need higher level services that can still be delivered on an outpatient basis, are you still not able to get them because you can't afford them? That's what National Health Insurance will bring to you right now. You'll be able to get those things without any payment in order to access them. We want to make sure there are promotion activities involved. We can't just think about how do we deliver care on the front end, because primary care is really built on promotion and prevention, keeping you from ever having actually gotten sick, so that moving forward, you will be able to keep yourself healthy and not have to necessarily worry about relying on the health system to do it for you. But the health system and the country as a whole, we want to move to making ourselves healthier. So the promotion, making sure that we counsel mothers about breastfeeding. We talk about infant mortality. Breastfeeding is one of the #1 ways you can actually reduce your rate of infant mortality, making sure that mothers continue to breastfeed during the appropriate times. Making sure we monitor and promote good nutrition and good health practices, especially amongst our young children and our adults. From prenatally straight through childhood, we know that's when people are most affected by it. We need to promote healthy habits that will keep them being able to stay healthy throughout their life course. But that starts early. We need to promote those types of activities. We need to make sure they're aware of the health services that are available to them so they access them early as well. We need to have preventative things in place. We need to make sure that we have counseling and prevention strategies around obesity, around diabetes, skin cancer, high blood pressure, sexually transmitted diseases. We need to make sure that people know what it is they can do when we put measures in place to keep them from getting there as well, both in care and education and through policies that we can put in place in country. We know that immunizations or vaccinations have been the #1 health promoting activity and health keeping activity of the 20th century. This isn't just something that we say, but we know that it's been the biggest public health intervention that has affected all of us and affected the morbidity and mortality that's happened over the course of all of our life courses. These are things we need to continue to solidify in country and make sure we have available access to all of those for all people within country, especially some of our vulnerable populations. Finally, we talked about care, and this is really a reiteration of what we said before. We need to make sure we deliver these pieces of care. We need to make sure your visits to your primary care physician, whether your primary care physician is a general practitioner, a family medicine specialist, a pediatrician, an internist, or even when you're getting prenatal care services at an OBGYN, those services need to be covered, and those are the things that we'll cover in the primary care phase. We talked about diagnostics, labs, and imaging. Those things will be covered. Prescription medications, those things that need to be delivered on an outpatient basis will be covered through primary care. Your newborn care, once your child is born and they need to see an individual in order to get that care done. Those things will be covered, including the immunization that we talked about before. And finally, treatment of minor illnesses. So not just that annual physical exam, but if you have a minor illness that can be seen at a clinic or an outpatient basis, those are the types of visits that will also be covered through primary care. We do hear all the time about whether you have to give up your health insurance or not, and we want to emphasize again and again that especially now that we have primary care being delivered at no cost to you, there's no reason for you to believe that you need to give up your private health insurance. We want to give people the opportunity to see, touch, and feel what it is that National Health Insurance brings to you in a manner whereby you don't feel as though you've been disadvantaged. We've had you lose anything in order to get it. You have a perfect opportunity to be able to feel something, to see it. You'll be able to get benefits before there's any bill for it, and you'll be able to see how NHI Bahamas gives you something, and for once, you can actually feel as though I'm getting something almost for free, and then I get to decide, do I need more, do I want more, am I willing to pay more to get those additional benefits to go along with it? That's not to say that in the future insurance plans won't change. It's not to say that you won't be able to negotiate different rates. But for now, while we introduce the care services through primary health care, you have the option of being able to do so or not. So what's next? Again, we re-emphasize that people have already started getting their National Insurance Board card, their new smart card. So they've been able to get that card, but we want more people to go out and get their new NIB smart card. Because remember, in order for you to enroll in NHI, you need to have your NIB smart card. Once you're able to do that, we'll then move into actual enrollment, and we'll get people involved in NHI proper. We'll also be able to then have, as you choose your primary care physician and your regulated health administrator, we'll then branch out and actually delivering services. After that, those other phases will kick in, the select catastrophic coverage, and you'll also be able to access the full benefits package as the program moves along. But we need this to start. What's most important is that we don't continue to lay back and just see that national health insurance is something that we aspire to. We need to take those first steps along the journey and actually start our march in the Bahamas toward universal health coverage through NHI Bahamas. So again, you have a role to play. We all have a role to play. We need to make sure that all of us get our new smart card. We need to ensure that you get your card to get your care. Now, what we want to do here is actually have an opportunity to hear specifically from the Ministry of Health through our Chief Medical Officer, Dr. Glen Beneby, who will give us an opportunity to really hear what it is that the Ministry of Health and the government of the Bahamas is really doing to strengthen the health system in country so that you can have faith that as we move through this and we have all of those phases come in, that the system will be prepared in order to deliver all the things that we promise that will come through National Health Insurance Bahamas. Dr. Beneby?
Thank you, Dr. Brennen, and I believe that we all have some idea now, the stage is set as to what we're looking at in terms of NHI Bahamas. To move into health system strengthening, which is the responsibility of the Ministry of Health, it's like getting the product ready to deliver the healthcare services throughout the country. And there are a few things I need to say first, just to set the stage. One, that the Bahamas is not New Providence. The Bahamas is an archipelago extending from Abaco to Inagua, some 100,000 square miles. And so when we look at introducing and improving the health system, we have to look at improving it in a comprehensive way. And so in that regard, we look at it in the context of equity, accessibility, and the point that Dr. Brennen spoke about, the financing aspect, which is national health insurance. So let us then look at this in this way. Universal health care coverage, which is not just peculiar to the Bahamas, but it is something that the world has recommended. POU has recommended. In December last, they launched Universal Healthcare Day on the 10th of December 2015, and then they made it very clear that in terms of countries that have signed on to this, It is the right thing to do. It is the smart thing to do. And in our countries, particularly developing countries, it is overdue. The 4 pillars of universal health care coverage are as follows. 1, clinical governance. The second one is social determinants of health. The third is health system strengthening. And the fourth is health financing, or that arm which we have been so concerned with, NHI Bahamas. How do we actually pay for the services? Why is single governance, clinical governance so important? Remember, it is universal health care coverage. And so we will be providing services not just in the public sector. So often the people think, the public in general, feel that national health insurance is a public sector venture. It is a healthcare industry product which involves the Department of Public Health, the Public Hospitals Authority, and the private sector. In order for us to do that in an equitable manner, then we must have the same policies, the same procedures, the same measures in all the healthcare industry sectors, so we're doing the same thing. And once we start this process, and you have your card, your smart card, once we start the process in primary care, the aim is that you'll be able to use your smart card in the private sector and the public sector. Immediately as I say that, it becomes very clear to you that the capacity of the healthcare system is very much improved and much larger than what we see now. Equally, as I say that, you realize how important it is for us to upgrade the services in the public sector and in the private sector. And we have been doing these things over the past several months, some of which you may or may not have seen. Some of you who drive around would see the improvement in the private sector, and I'm going to tell you about some in the public sector. What we have done is that we are regulating the system. So we have upgraded the medical laws, the council laws, so we are now able to better regulate and police our system. And I remember I said to you the system is in the public and the private sector. We had a summit where all of the councils and regulatory bodies came together and discussed how best to upgrade their services to be ready for national health insurance. The process is not yet finished. It is a journey. We are going slowly, steadfast, and focused to accomplish these goals. Let me say to you though, what we realize is that we must reach a certain point where you, the public, have to feel what we are doing. This is what Dr. Brennen spoke of. It's things that are tangible. So what are some of the things we tend to want to do and will be doing? Indeed, we're in the process of accomplishing. In the public health clinics as we speak, we are renovating those clinics. And the major clinics, Elizabeth Estate, South Beach, Flamingo Gardens, and Fleming Street, we are extending the hours of care. We are reconfiguring the clinic so the clinic is more consumer or patients friendly. We are wanting the communities to be involved. We have spoken to our staff, and we have to continue to do it, as well as to get the input from the entire area. Because community-driven services is what we are aiming to do. And in order for us to have community-driven services, we must have the public involved. One of the reasons why we're here tonight is because we want to hear from our stakeholders, and all of them. Not any particular group. Yes, we want to hear from the physicians. Yes, we want to hear from the nurses. Yes, we want to hear from the insurance companies. We want to hear from the churches. We want to hear from the unions. We want to hear from the common man on the street. We want to hear from our consumers. Because by so doing, we are able to adjust our system to improve the overall quality. The overall quality of the system will be improved by improving the infrastructure. And you would have heard and seen some of the advertisements on television in the Public Hospitals Authority, where we will improve the information systems in the operating theaters. We shall be improving the way the patients are actually seen in the accident and emergency in Princess Margaret Hospital. Already, we have improved the system of patients being seen at the Rand Memorial Hospital in Grand Bahama. We are seeking to offload or to decrease emergency persons from going in places where they need not be. Perhaps I ought to put it better by saying we want to improve the elective patients, patients who have the common headache and colds and flus, to be seen in the clinics as opposed to coming into accident emergency. This is not something that's going to happen by a clip of the finger and happen overnight. It's going to take us an education process to be able to do that, and we have started the education process. We are talking here tonight. We'll be talking in Grand Bahama tomorrow, and we will continue the conversation right across the archipelago to get people conscious of using our system better. We want to stop patients who come to the public sector having to stand outside of clinics early in the morning. You see a patient come to the public clinic, and they're from 7 o'clock and they leave 1 or 2 o'clock in the afternoon. So in order to change that culture, we shall have an appointment system. We shall rearrange the way the actual staff works. And also, we plan to have a transport system to bring the disabled and the elderly to the clinics as a part of the process of improving the community satisfaction and involvement in our clinics. These are some of the things that you will see over the next 6 to 8 weeks. In addition, we have ordered ambulances. We expect to have an addition 10 ambulances here in the next 2 months. We will prioritize where we are sending the ambulances. And the reason why that is important, right now we know it takes us some 30 minutes plus to get a person who is injured to the center, to the hospital, and that is much too long. What we'll be doing, based on our studies, is that we reduce the ambulance time from the site of where the incident occurred to the hospital in less than 12 minutes. Indeed, it will be better if it's less than 10 minutes. This will occur because we shall place strategically the ambulances next to Flamingo Garden, next to Elizabeth Estate, one at the airport, and somebody asked me today, what about the Family Islands? Yes, based on the population size and how far we have to travel in the Family Islands, we will be placing ambulances in various Family Islands. I know now that we will place an ambulance in Exuma. I know now we will place an ambulance in Andros. And of course, we will be placing ambulances across the archipelago in accordance to the demand of the service and what the needs are. This is not equal, this is equity. We are doing what is necessary to get the job done. Something else I need to say to you. Everybody put emphasis on doctors and nurses, but doctors and nurses don't run the healthcare system. Yes, they are leaders in the healthcare system, but the healthcare system, like an airplane, have a pilot and stewardesses, but you also need engineers. You need persons who take care of catering. You need persons who fix other equipment, biomedical technicians. We are training as we speak patient care technicians. We have more than 60 of them in class, the first grouping. We are training by the end of another 6 months, we'll have more than 100 persons. What that means is here we will be able to provide 2 healthcare providers to support persons at the front end. And each clinic will have an additional number of persons. We will also be able to provide these patient care technicians to residential homes and places where persons are cared in their homes. And in addition, we will make this available to non-government organizations that take care of patients, such as churches and Red Cross. And we are also training at the same time anesthetic assistants for the operating theater. We are training surgical technicians who will assist with operations in the operating theater, and emergency technicians who we will place throughout our Family Islands. These persons will be cross-trained, meaning that if you happen to be an emergency medical technician, you will not just sit down when you are in Abaco at the clinic, but you will be able to do tests, to do ECGs, that's electrocardiograms, be able to do basic radiographs, because we are going to cross-train these persons, ultrasonography as well. It is very important for us to upgrade. Significant. The Public Hospitals Authority announced last week that they intend to upgrade the radiography services or the radiology services. And we are going from analog to digital. And what this means is that we will be able to do an X-ray in the clinic in South Beach or Family Island and transmit that result via digital technology through a consultant or a specialist in the hospital. So these are things that are very important. We are bringing technology to bear. Right now, as I speak to you, I have an application which can allow me to assess a patient in a Family Island using BTC's technology and fiber optics. That, you come to realize, is very important. And so a patient who leaves Nassau or a patient who is seen in one part of the Family Island, we will be able to follow that patient through discharge planning, and we're going to do a pilot test on discharge planning using that kind of technology, which is scheduled to start at the end of February. So we are doing these things so people can see what we are doing, make sure that they understand what we are doing, and as mentioned before, perhaps more importantly, is the social determinants of health, or health in all policies, population health. So what are we going to do? Along with the NHI Bahamas, the Ministry of Health will join hands to go into the schools. You know, nowadays, we are faced with a real challenge because we are seeing young children under the age of 12 with type 2, meaning diabetes that is acquired. So what that means is today, when people reach around the age of 50 or 60 years old, we see the complication of diabetes because those complications started 20, 25 years ago when the condition started. So if it's starting now at the age of 12, when these young people reach in their 20s and 30s, we're likely to see heart conditions, more strokes, more blindness or problems with vision. And the thing that plagues us really a lot is renal disease or renal failure. Right now we're spending $60,000 to $80,000 per individual to give them dialysis on an annual basis. So we will save if we get people to not just pay attention to their health, but to understand why they're doing what they're doing. And so we're going to provide diets low in salt. We're going to reduce the sugar. We're going to have our children exercising. You know, when I went to school just the other day, we used to have PE classes. Now, PE classes are not mandatory anymore. You know, we used to go and say, hands up a stretch, bend forward, and it was something that we look forward to. Today, they're all playing on their little computer and their tablet and not exercising. And this is a good thing, but you have to exercise to avoid illnesses that occur as a result of not exercising. It is well proven that by weight loss and exercise, we can reduce the prevalence of diabetes in our society. So there are two things, two areas I have talked to you about, and I haven't focused on health system strengthening yet. So in 5 minutes, I'll focus on health system strengthening. I talked to you about single governance. I talked to you about population health, having healthy societies, parks, water that is potable and you can easily drink. And we see how important that is right now with the Zika virus. If we operate the way we ought to, with healthy communities, healthy societies, understanding, we will not have the vector. And if you don't have the vector, you won't have the disease. So tie it together, understand what this is about. Now, health system strengthening. Health system strengthening, as I said earlier, can be in two broad categories. The infrastructure, which I talked about, the actual clinic, and improving the equipment and the walls. But the most important part of health system strengthening is the human factor. And that is how you treat people when they're ill. And so we have classes now ongoing as we speak for soft skills training. We have classes for pastoral care being conducted as we speak by Canon Sebastian Campbell. We have classes that, as we speak, I told you earlier about the allied health classes. But we have classes for safety and quality so we can upgrade the standard and the overall care in our healthcare system. All of these things have to be monitored, and we have to put a benchmark. So we have indicators, this is where we started, and this is where we are going, and this is where we intend to be. By 2030, the Bahamas will be in the top 10 countries in the world in health. Why is that important? Because it will improve our productivity. It will improve our quality of life. It will improve our ability to attract people to the Bahamas. Everybody wants to come to an area where the persons there are healthy and fit and are able to live a better quality of life. And so our life expectancy now in females is around 69, in males, pardon me, is around 69, 70, and in females about 76. But with this kind of quality of living, we expect to put our life expectancy well above 80 years. And if we do that, and we spend our money better, we will be a healthier nation. And the wealth of the nation is dependent on the health of the nation. Before I stop speaking to you, I want to leave this thought with you. If we have the best qualified physician specialists in this region, in the English-speaking Caribbean, if we have the nurses who are recognized as the best public health nurses, and whenever they go to North America, we lose them, and we can't train enough of them. If we are strategically placed geographically between the North and the South, and therefore we have the advantage of the technology from the North and the advantage of the manpower and support systems from the South. If we are so placed, there is no reason why universal health care coverage and National Health Insurance Bahamas should not work. If you listen carefully to what every stakeholder is saying to us, including the insurance companies, the physician bodies, they're saying to us, we support universal health care. The difference then in opinion comes in how we do it and how we actually go about doing it. This is a journey, and on this journey, we will not get it all right the first time. But with monitoring and evaluation, which we are putting in the system, we will be monitoring where we are, an assessment of where we are. We will be modifying our policies as we go, so the policies allow us to deliver the kind of service that we wish to deliver. And if you note, when we started, the system of our preparation included stakeholder involvement, and as a result, we have a large number of input. No, we haven't changed everything, but we have changed enough to satisfy us that we are headed in the right direction. And so I say to you, Bahamas, I say to you in this hall, give yourself the benefit of doing this time the right way. Think about it. Think about what people are saying to you. Is the Bahamas better off with National Health Insurance Bahamas, or are we not better off if we do nothing, or if we don't do the right thing, the smart thing, and the thing that is overdue? Thank you very much.
What we want to do is sort of wrap things up and just let people know that, again, this is the launch in Nassau and in New Providence, really having a discussion related to this, but because we're able to engage those throughout our Commonwealth over the radio and a continuation of our discussion on TV and being able to let people know really where we are with this, we want to let people know that, again, This is really the beginnings of these discussions. We want people to know that we'll be coming into your communities. Look out for us. We do have a website that we want people to be able to engage with us on. We have a Facebook page. So if you go to www.nhibahamas.gov.bs, you'll actually be able to engage with us. You'll be able to send us emails. You'll be able to look at our frequently asked questions. A lot of the things that the misinformation that's out there can really be cleared up by looking at what is already available for you through the website. But we do have an email address. We do have a phone number. If you want to contact us, you can call us at 502-7601. We have a copy of those frequently asked questions right here tonight, so you'll be able to take those with you as well. But do know that we want as much for you to be engaged in this dialogue, both as stakeholders and individuals who will be affected by this, as anyone else, because NHI Bahamas is really for you to see, touch, and feel as you begin to get better health care, but also lead to a better health status in country. That's what we really want for you, and that's why NHI Bahamas is being put in place. So again, I want to say thank you for everyone who's able to listen in, hear a part of this conversation, be a part of this conversation, and we'll move ahead with continuing to forge a relationship with you and making sure that NHI Bahamas delivers the best product that we can for you now and into the future. Thank you.